Okay, so we're back with Allie. Now we're at her posterior knee, and the posterior knee is the popliteal fossa, okay? The popliteal fossa is made up of basically your superior and inferior tendons. So we have the hamstring muscles that come like this, and we have our gastroc muscles that come like that, and it forms a nice little diamond in the posterior knee, the popliteal fossa. Right in the middle is going to be the popliteal artery, all right? And we can actually palpate her femoral condyles posteriorly if we wanted to get there. So what we're going to do now, though, is we're going to find all our hamstring tendons, have fun with it. So first thing we do, we're going to put her about 45 degrees, and I'm going to ask her to bring her heel to her butt, and you can see immediately the hamstring tendons pop back out. Now, because we have actually palpated, we can actually follow them all the way. So I'm going to ask Allie, I'm going to touch your butt. Is that okay? Yep. So I'm going to start here on ischial tuberosity, which we already know. I'm going to come all the way down. I'm going to have her pull her heel to her butt. And I can follow right here. That's biceps femoris. You can see that tendon right there. I can follow now all the way to the fibular head. Okay? I can also find her iliotibial band. You can see they run right next to each other, but I can follow it all the way down. On the medial side, same thing. Ischial tuberosity comes all the way down. I can feel the tendon in the popliteal fossa, inserts into the posterior tibia. Ischial tuberosity comes all the way down, and now I can palpate the pesi and serine. All I'm doing is connecting the muscles with all my bony landmarks. I said it in class. If you know the bony landmarks, connecting the muscles just by memorizing the origins and insertions. I understand that can be a little bit of a problem, but it's just really all about memorization. When you are going through any part of the body, though, do your mental gymnastics and really try to think of the body as interconnected. So if you're down here thinking about the fibular head, think about all the structures that go there. The fibular collateral ligament, the common peroneal nerve, the origin of peroneus longus, and the insertion of biceps femoris. You got 4 other structures besides the fibular head itself, all in that area. Start thinking about that. Start thinking about the body in those type of terms. I think it really makes things a lot easier. The muscle worksheet should also help, because that's just basically memorizing origin insertion. And then just go find a friend, a colleague, a significant other, and just find it on them, palpate on them. Feel free to use markers, stickers, whatever you want with their, obviously, permission, and you can start visualizing it. Use the trail guide if they teach you a different way to palpate stuff, but it's all coming back to the same thing. In the next video, we're going to talk about bringing the lower leg musculature and how that comes down into the ankle. All right?